Okay, ready, set?
Yes, sir.
Okay, so I wanted to talk to you because potentially the problems that are coming up with your husband could be serious. And I'm a little worried because some physicians and surgeons can get this wrong. And we have had experiences with patients who get in trouble not making it because there's some lack of understanding. So I want to give you some tips and pointers and give you this video. So, if you want to remember it or convince the doctor to call me. So that's the goal of today, if that's all right.
Yes, yes.
Okay, so just to summarize, to go back over things, your husband got admitted to the local hospital there, and after being in the hospital for several days, got explored for a perforated ulcer at his MGB site.
Right.
And how long was he in the hospital before the operation?
He was in ER waiting for 27 hours.
Okay, so just over one day.
Mm-hmm.
And then after he was operated on, they said they found the perforated ulcer and they stitched it up, and that's all they did, or did they say anything else about the surgical procedure?
That's exactly what happened. They found it, they stitched it up, and that
That's
was it.
good. And his MGB was about how long ago?
3 years ago.
And that was in Tijuana.
Right.
And he was weighed about what weight? Do you remember?
He was 387 when he got to Dr. Rubunen's office.
Okay. We won't use any more names.
Oh, yes.
That's
Sorry.
okay. No, that's all right. So, and when he had this admission to the hospital, the days and weeks before he got admitted to the hospital, he weighed about how much?
145.
Okay. Was he getting a little too thin? Did he look kind of sickly?
Yes, absolutely.
And how long has that been going on?
5 months.
Okay. All right. Well, and okay. So then they said, well, everything looks pretty darn good. We found an ulcer, we fixed it, and everything should be fine, is roughly what they said.
Yes.
And he stayed in the hospital for how long after that?
Uh, about 3 weeks, 2.5 weeks. Yeah.
Yeah. And did they say, I mean, seems like a long time to be in the hospital for my experience with a perforated ulcer. Did they say anything about that, or were they surprised, or they said, he looks a little malnourished?
Yeah. He looks a little malnourished. We would like, they did start him on TPN.
Right. Bingo. Okay. So here's the thing, that around the world, there are people who think the MGB is great and other people who've had troubles with it. And it can be because you're not clear on some things. So I'm going to interrupt our discussion and I'm going to go to some slides, which might be a bit over your head, but we'll come back and talk about it. But what I want to explain is, why is he having trouble? And one thing you could say is, oh, you know what? It's the bypass. The bypass is too long. And that's possible, but why would it occur 3 years later? What's the deal? And why is it getting worse now? And why hasn't he gotten better? And so we want to talk about those things. And then maybe, obviously, I can't be your doctor, and this is not medical advice. And I have this thing, it's like I play a doctor on TV, but you have to get medical advice from your own doctor and all that stuff. But I'm hoping that some of this information will be useful to you and your doctor. And I volunteer to talk directly with a physician there if they would like some more information. So if that's okay, I'm going to go ahead and talk some more about this.
Yes. Thank you.
Okay, so I'm going to share my slides. And some of this will be maybe a little bit over your head, but I think as we go over it and talk about it some more, but this is a good background. So there are people who say, oh my goodness, the MGB is too powerful because one or two people around the world will get malnourished and they've actually had to operate and undo the MGB. And that's easy to do, but you don't always have to do that. And some people have delayed undoing the MGB, and some patients have died around the world. And I've had the good fortune to consult on a few patients and keep them from getting into trouble. So one of the things that people think is, well, we understand why your husband's getting sick. His bypass was just too long. So that's a common belief amongst doctors around the world. They say, oh, if somebody gets in trouble after MGB, then what happened is the bypass was too much for them. And that makes perfect sense, except why did it suddenly happen at 3 years in your husband's case? Or why does it happen in short term or medium term or long term? So what we're going to talk about here is this controversy over the biliopancreatic limb length and the cause, etiology, the cause of malnutrition, hypoalbuminemia, and liver dysfunction, and even death. And we're going to say sometimes it doesn't get diagnosed correctly. And if it's not diagnosed correctly, it might be not managed well and can lead to trouble. So we're going to talk about that today.
Okay.
Okay. First of all, we know that in the MGB, the longer limb, the longer we bypass, the more weight loss, and also better effect on the blood sugar levels. But there are this fear, well, if you bypass too much, people can get in trouble. Well, what we're going to say is back in 1965 and earlier, we've known that it's not just the length of the bypass. Excuse me. And so here's a famous doctor. Everyone who's in surgery knows this Dr. Starzl. And he did an article, and it shows it's not VP limb length. And we're going to talk about that. Okay, fear of malnutrition. Yes, it happens, but it's not VP limb length. And I'm going to mention a couple of words, which I'm going to ask you if you've heard about. Have you heard about the business about the gut bacteria called the microbiome?
Yes.
Good. We're going to talk about those bugs. And to give you the end of this discussion right now, his primary problem, if you ask me, is the antibiotics and the something in his diet. You know, maybe he wasn't eating as healthy as he could, and that led to a change in his gut bacteria. I think you told me he had a test for Clostridia difficile, right?
Yes.
Okay, and that's a good idea because that's a bad bug that can cause diarrhea, malnutrition, and even death. But it turns out it's not the only one. If you can imagine that there are several trillion bugs inside of everybody's colon, C. diff is not the only bad boy. And so you may have heard of Montezuma's Revenge when you go south of the border in Mexico.
Yes.
Yeah, that's a bug often called Giardia, but it can be a variety of other bacteria called Salmonella, Shigella. These cause a sudden, what's called an acute illness, where you get sick suddenly and you have to get treated for it. But this is an example where if you get bad bugs inside of your gut, it's not good for you. And we're going to talk about the change in your microbiome called SIBO, or small intestinal bacterial overgrowth syndrome. Now that's kind of mixed up also, because a lot of doctors are focusing on something called irritable bowel syndrome, which they used to blame on women being depressed. And now there's some good data saying it's some bad bacteria. What we're going to say for your husband's case, in short, is that we think he has got an overgrowth of bad bacteria, and maybe he's had it for a couple of months while he was getting sicker. The ulcer perforated, he's still in the middle of that. And now we need to treat that in an MGB patient. And again, I'll cut to the chase. Here's the answer. If you have this small intestinal bacterial overgrowth, it's also called, as we're going to see in the kind of next slide, I guess I can go over it. Okay, this is pictures of somebody who had an operation like the MGB. This is the stomach, and then this is the loop, but you see this loop is all swollen, and you can see this, and this is, so all of these end up with, it's called the blind loop syndrome. The blind loop syndrome means that over time, this small intestine gets bacterial overgrowth. And we've known about this since 1965, but when an MGB patient gets sick like this, a lot of the doctors get confused. They say give TPN. In fact, TPN, though, is a setup for getting C. diff. So you need the nutrition, but we also need to deal with this blind loop. Now, what can we do? Well, first of all, if it's not too bad, then number one treatment is simply to eat healthy, to eat more fiber and fresh foods and things like that we can talk about. If you get more seriously ill, then you can do healthy foods and antibiotics, oral antibiotics. There are special ones which we'll go over called rifampicin, and you'll want to mention that to your doctor and see if he would consider it or if he thinks it's correct or something like that, because it's particularly good at killing some of the bad bacterial overgrowth bacteria. And then the third choice is just undo the MGB. And the nice thing about the MGB is it's very, very, very easy surgically to undo it. And basically, to explain that, we'll look at a picture of an MGB later, I think. Let's see if I can find it. Okay, so here's an MGB. Can you see that okay?
Yes.
So here's the MGB, and to undo it, you take we have these little staple guns. You click here, and then you click here to put these two back together, and that's it. And depending on what they did at this previous operation, it usually takes only anywhere between 20 and 30 minutes. So here's what I would say from a long distance for your doctors to think about. Number one, why is he sick now? In other words, the usual perforated ulcer is better in a few days, nothing else to worry about. He was sick for months before this, and he's sicker after. So why? My suggestion is he has a bad bacteria growing in his gut. Not just any gut, but the upstream gut here. This has got like the bad picture. I'll go back to it. Okay, see how these look ugly? There's something ugly about this is called the blind loop, also called the apparent loop. Something in here is sitting here and kind of rotting, so to speak. Bad bugs. You know, when something rots, you get this bad bacteria. And normally we have good bacteria that like us and live with us. And because of this partial blockage, because of bad eating without enough fiber, different things we don't need to worry about now, this is now a pool of bad stuff. And so when you get sick like this, you have three choices. If it's not very bad, start eating healthy and stop eating junk food and don't smoke and drink and things like that and coffee. We're probably past that. The second thing is we can do healthy food in addition to the TPN and antibiotics. Particularly one is called rifampicin, but there are several other anti-anaerobic, anti-bad bacteria antibiotics like metronidazole, also called Flagyl. And so those are all worth considering. And then choice number three is to get surgery, and we'll kind of draw surgery a couple more times for you. And that's what I think is going on. And again, I would give my email, my telephone number. Well, I'm in India now, but email and any way to get in touch with me. I can do Zoom or any way to talk to your doctor there if he would like my tips and pointers. So let's look at the surgery one more time. Here's a good picture of it. So again, this is the old surgery that the MGB is based on. But to undo this surgery, we have this staple gun. You go once here, and then you put a hole here, a little hole here, put the staple gun inside and click that, and you're done. The MGB is out. So it's very easy to do. Now, why is that good? Because now the food will wash through the blind loop. Does that kind of make sense?
Yes.
So this is this kind of a cul-de-sac if you lived in an expensive neighborhood, or if you live in a bad neighborhood, this is a bad neighborhood. And it's got bad bugs growing in here. So what we want to do is this is washing everything this direction, but it's building up and sitting there and kind of going bad. It's got bad bacteria. It did well for 2.5 years, roughly. But now, and usually when I talk to patients, they've been kind of well, to be polite, imperfect on following a good diet. And when they eat some junk food and stuff like that, then what happens is this gets contaminated, and then they can get in big trouble. So it's like I'm going to the beach and swim. As long as the water comes up to my knees, pretty safe. But you swim out a mile, now we're talking about life and death. So this now is suddenly a big packet of bad bugs. And TPN doesn't help the good bugs. TPN actually stimulates bad bugs also. So what we want to do is get healthy food in there if we can. And a lot of hospitals don't have that much healthy food with fresh fruits and vegetables and whole grains and stuff like that. So it may be beyond that time. Maybe we can't do that now because we're in stage 3. And stage 3, operate sooner rather than later and divide this with the staple gun and then staple these two together and you're out. It's about 20 minutes. And so that's my short discussion there, and I'll stop and answer any questions, but that's what I think is going on. And if you miss that, then it's pretty deep water.
Okay. Yeah, that's where I was unclear. You know, how far do we go until we, you know, start discussing reversing it? And
Yeah,
then
if he's sick now, you know, when you go to look at him, he looks pretty bad when you look at him.
yeah, he's 132 pounds as a 6'1" man.
Right. So that's the end of the discussion for me. Now, convincing your doctors to do that, I found around the world is challenging. So I volunteer to talk with them. You'll have this video to show them. You know, you could, if they'll watch it, I'm going to put it up on YouTube and I'll send you the link. And
Okay.
I'm available anytime, but this is very serious. People have lost their lives if they delay on it. Some people will say, oh, we'll just give them TPN because they can't find another diagnosis. They'll just say it's, they just need food. And that's not the case. For example, and the good example is to bone up on Clostridia difficile. You can think of this as Clostridia difficile infection by another group of bad bacteria. It's like, you know, let's say they're in some movie, there's a bad guy, but he has a whole crowd of bad guys with him. And so it's not the leader of the pack, or C. diff might be called the leader of the pack for this kind of problem. But there's a bunch of other bad guys out there and they're causing the trouble. Sometimes though, the antibiotics for the main bad guy or C. diff are also useful. And again, they may want to get cultures of the bowel content and things like that, but just TPN doesn't fix it. What's going on will be confusing to them because probably he doesn't have an infection. And the antibiotics you use for an infection in the bloodstream or something is different than what you use for bacteria in the gut. So there are some tricky parts, and urgent surgery would be top of my list if he's not doing great very soon, or if he's worse than I can kind of glean from the telephone call. And but that's of course your doctor's decision, not mine. But I'll be available anytime, day or night. As I say, I'm in India right now, but I do have Zoom, and a lot of other people use WhatsApp or Facebook Messenger to call, or we can do a Zoom call. So whatever would be convenient for your doctors, if I can help in any way.
Okay. Thank you.
Do you have any other questions? Did I get too confusing, or did I do a bad job, or my slides mislabeled or anything?
No, not at all. I have the frustrating thing for me is I have a master's degree in dietetics, and so this has stumped me. And your guidance and explanations have been really beneficial for me to fully understand what we really need to do next. I really appreciate your time. I can't
Let me
stress
interrupt
that
you and
enough.
say, I get in trouble with dietitians all around the world because this is just something, excuse me, it's something most dietitians and surgeons have forgotten about. It's from the past, in that what happens is the blind loop, or it's also called the afferent loop syndrome, is something well known back in the 60s and 70s. And excuse me 1 second. Sorry, I apologize. And so we knew about it. There's old articles on it, and but now there's a lot of confusion. And the gut microbiome, though, is now more able to explain things. Like, I'll tell you one more thing. When people would get the blind loop syndrome, they would get low B12. And if you get your husband's level, he might have a low B12. And they would say, see, he's not taking his B12. But it turns out that when these animals and people in animal studies and people got this the blind loop syndrome, the bacteria that grows in this area of the blind loop actually metabolize B12. And so it's not that they're not eating enough. It is that this, I would say, kind of cesspool of bacteria ends up growing. Now, you don't have to have a blind loop to have the same thing happen. It can grow in certain people, even if the rest of their gut is normally connected. And what happens is if they just eat poorly, they get an overgrowth infection by going to Mexico, or they get some other bacterial infection, then things take off and get worse. But many of the dietitians who are bariatric specialists and many bariatric surgeons are not familiar with this, and it leads to some other confusions and sometimes poor outcomes with the MGB and other operations. So it could be that you're going to face some trouble trying to get time to talk to the physicians in charge and explaining that just giving more intravenous food may not help the gut microbiome. The other thing you might think of is, oh, we'll give probiotics. And is it okay to talk about that for 2 seconds?
Yes, absolutely, because that's exactly where I was at right before I reached out.
Yeah, well, the idea of probiotics actually work in animals, but they don't work very well in humans. And the brief reason is because when you dump them into the stomach, your stomach's designed to digest and kill invading bugs, so that the number of healthy bacteria that you get across the digestive tract is small. The way to grow healthy bacteria is not by transplanting bugs, it's by making the soil attractive. And what that means is basically healthy fiber for food. So it means, steel-cut oats and, bananas and apples and things like that have fiber, because that fiber is like the ground that you want to grow a new garden of roses. And presently you've got crab weeds and poison ivy and all kinds of a mess out there. It's nice to think, well, we'll just give good, healthy bugs. And it's probably not the end of the world. But like, for example, you don't want to give your husband anything like yogurt, because the milk has lactose in it. And lactase insufficiency comes from this infection. Plus, they have a bypass, and the majority of lactase is in the upper gut. So a lot of this is kind of technical, but since your medical background, I hope some of it is not too much for you to hear about this morning.
No, it's right on. Thank you.
Okay. Any other things that I should talk about, or should I apologize for saying in an incorrect or wrong way? See, a lot of times I'm a little too blunt sometimes.
No, I needed direction, and that's exactly what I got out of this. So
Yeah.
again, I want to thank you for your time.
Yeah, and if the surgeon wants to know how to do it, I've got videos of it, and I can talk with him step by step on how to do the reversal. And depending on how he's doing, that might be the best thing to do, and sooner rather than later, because most of the time, once it gets to the kind of worst stage where they're thinking about C. diff, for example, that's where it's appropriate to move quickly, because every day you just kind of get sicker because you're more and more malnourished.
Yeah, and I will say this, after we checked him out of the hospital last time, he just this last week, when I got him back, we were doing every 2 or 3 hours, we were feeding him, and we were right above 2,500 calories, and he's still malnourished. He never gained any weight. He was losing weight on 2,500 calories and 140 grams of protein, and we had the steel cut oats, we had bananas, we had apples, at that point I didn't know what direction to go, like, how is he still losing weight and so sick?
Well, wait, let me interrupt. Yeah, that's the answer, though. In other words, those things only work if your gut works. In other words, you might as well be when you're forcing that through, you're not growing new bacteria. What in fact, by forcing it, you need to fill his protein and carbohydrate and fatty stores as well as vitamins. But by pushing that through as a treatment, it's like say, nothing is growing in this field. I'm just going to keep trying to tear it up and plant and tear it up and plant. And what we need is we got to get better soil. And that's hard to do. And if you can't do it, then what it means is that we have to go to the more radical, which is change the surgery. And it's unfortunate, but the things that when you are pushing those foods, it's possible. We could go through in detail what you chose. But for example, protein powders, for example, routinely actually make things worse. And it seems like a reasonable thing to do because you have low protein. But here's another factor. People see people who are malnourished and they say, look, the albumin is terrible. Like, do you remember, did he have a low albumin?
Yes, all his serum, yes, they were all low.
But wait, here's the thing. People who are sick get a low albumin. So in other words, if you're stressed, your body understands through millions of years of evolution that the bacteria eat albumin. And so even if you're fully nourished, what happens in response to stress is your albumin goes down. So again, a lot of times I've seen other doctors, forcing TPN and nasogastric feedings and things like that, and with just things getting worse. And the reason they're getting worse is because that food has trouble being converted into healthy parts of the body, because in part, the body is saying, look, we're really fighting a battle here, and we are not going to raise our albumin. We don't want that until you get over the illness. And so acutely raising that in the midst of a nuclear war, it doesn't work. And so what has to happen is you have to say, the most important thing is, where are we now? Are we in the mild, moderate, or severe? If we're severe, then operate. So I'm going to say that 3 times because I'm a guy, and guys always repeat themselves. And if they're a guy who's a doctor, you can't imagine. So anyways, so if you are in stage 3, in other words, they're on TPN, they look really sick, their numbers are worrisome, then it's very, very easy surgically to revise the surgery. Your surgeon there may not know how, but let me tell them it's easy. I've got videos I can show them, and I've got diagrams, and I'll help them. But if he's very sick, they are at risk of losing him, because people have lost patients like this because they're not sure what to do. They don't know what's going on. All they know is kind of what you were doing, which seems very reasonable. I'll just give him a ton of stuff, thousands of calories. But that doesn't go anywhere if there's no soil. That soil is the bacteria, which you and I live on, and that digestion is critical. Otherwise, the body says, I see I got a lot of protein, I'm just going to dump it out in the urine or metabolize it, because I'm not building anything right now. I'm not creating any albumin. I'm not going to. I'm in the middle of a battle for my life. So trying to feed in the middle of sepsis, it doesn't work. This isn't exactly sepsis, but it's in fact a septic, that is infectious complication in the small intestine. And much of it, maybe even all of it, is in that blind loop. So undo the blind loop is the most important thing. And oftentimes in making this pitch, that's why I'm doing a video on a telephone through a patient. It hasn't worked. And around the world, there have been deaths because surgeons and physicians are not familiar with this particular topic.
Okay. All right. I will definitely take this right up there.
Okay.
For sure.
I'm standing by. I'll do anything I can to help.
Okay. Thank you very, very much.
Okay. Bye-bye.
Be well.
All right.
Bye.
You too.